You look in the mirror and notice a dark, velvety ring around the back of your neck or your armpits. You scrub it, thinking it's dirt, but it won't wash off. You might also see tiny, red spider-like veins across your chest. You tell yourself it's just aging or a stubborn skin issue. It isn't. Your skin is acting like an alarm bell for an organ that's silently suffocating inside your body, your liver. This video is for educational purposes only, and this is not a substitute for professional medical advice or therapy. If you're worried, you're in the right place. For the next few minutes I'll explain, simply and compassionately, why that dark patch might be more than skin, what your liver is quietly trying to tell you, and what we can do about it early, while repair is still possible. Here's a key fact. The liver itself has very few pain receptors. It won't usually produce sharp pain to warn you. Instead, when it's stressed by excess fat and metabolic strain, it sends out quieter signals. Changes in your skin, chronic fatigue, sometimes a vague ache that travels to your right shoulder. These are SOS signals. I know how unsettling this is. You haven't done anything wrong. Modern diets, stress, and everyday foods can slowly tilt your metabolism toward insulin resistance. And insulin resistance is the driver behind most cases of fatty liver, a condition called non-alcoholic fatty liver disease, or NAFLD. Let me be clear. Noticing these signs now is actually good news. Why? Because early fatty change, we call it steatosis, is often manageable. The liver is remarkably regenerative. But it's a silent organ. If we wait until it's painful, the injury may already be advanced. That's why recognizing those quiet signals is so important. Over the next minutes I'll walk you through what those skin changes mean on a biological level, why that shoulder might ache, and practical, science-based steps you can take to reduce liver fat and improve insulin sensitivity. No gimmicks. No absolutes. Just clear, medically grounded information you can use. If anything I say raises questions specific to your health, your medication, your medical history, or your lab results, please check with your healthcare provider. For now, breathe with me once, in and out. Let's walk this through together. Let's get clinical, but clearly. The earliest, most common form of fatty liver is called steatosis. In medical terms, we generally consider hepatic steatosis present when roughly 5% or more of the liver's volume is made up of fat. It's an accumulation of triglyceride droplets inside the liver cells, hepatocytes, not an infection or a skin problem. Importantly, steatosis on its own may not cause pain, which is why people often don't notice it until we look for it. What drives those fat droplets? The dominant metabolic driver is insulin resistance. When tissues stop responding normally to insulin, more free fatty acids are released from fat stores. The liver takes up that extra fatty fuel, and the liver's own fat production, called de novo lipogenesis, ramps up. Certain dietary patterns, especially high intake of added sugars and fructose-containing drinks, feed that process directly because fructose is metabolized primarily in the liver and becomes a potent substrate for new fat production. Steatosis is clinically important because it's often a first, reversible step. If we reduce the input, less sugar, fewer ultra-processed carbs, improved insulin sensitivity, the liver can mobilize and export that fat. Remember, the liver is the most regenerative organ we have. It can remove fat and recover function when the metabolic conditions improve. However, if the metabolic stress continues, the liver can progress beyond simple steatosis to inflammation and cell injury. That stage is called steatohepatitis, often abbreviated NASH, where hepatocytes become damaged and immune signals are activated. With ongoing injury, the liver begins to lay down scar tissue, fibrosis. Over many years, fibrosis can build and eventually lead to cirrhosis, which is permanent architectural scarring that changes how the liver functions. It's critical to understand the difference in clinical implications. Steatosis is largely a metabolic accumulation of fat and is often manageable. Cirrhosis represents long-standing and significant scarring. Advanced cirrhosis changes blood flow and liver architecture and carries risks that require specialist care. While there is scientific evidence that fibrosis can regress to some degree if the underlying cause is removed or treated, advanced cirrhosis involves permanent architectural distortion that is far more difficult, and sometimes impossible, to fully normalize. So how do clinicians distinguish these stages? Simple blood tests like ALT and AST can suggest liver stress but aren't specific. ultrasound can detect moderate to large amounts of fat. Newer, non-invasive tools, like transient elastography, often called FibroScan, which measures stiffness, and MRI-PDFF, which quantifies proton density fat fraction, let us estimate both fat content and stiffness without a biopsy. MRI-PDFF is among the most accurate ways to measure liver fat, while elastography gives us a practical read on fibrosis risk. The main takeaway here: if you see those quiet signals, the dark necks, persistent fatigue, vague right shoulder ache, don't assume it's just cosmetic or simple aging. Steatosis is common and, importantly, actionable. Catching it in the steatosis stage gives you the greatest chance to reduce liver fat and prevent progression to scarring. In next section I'll show you 3 specific physical signs to watch for, and what they biologically mean. Now I want to walk you through 3 physical signs your body may be showing quietly. Signs that the liver is under metabolic stress. These are not diagnostic on their own, but together with symptoms or risk factors they are red flags that prompt a clinical checkup. Sign 1. Acanthosis nigricans, the dark, velvety skin. The first sign many people notice is a dark, velvety patch at the back of the neck, under the arms, or in skin folds. A condition we call acanthosis nigricans. It looks like stubborn hyperpigmentation and thickening of the skin, and people often assume it's dirt or friction. In reality, AN is most commonly a visible marker of insulin resistance. Chronically high insulin levels drive skin cells and pigment-producing cells to multiply, causing that textured, dark appearance. Importantly, multiple recent clinical studies and reviews show AN is associated with metabolic dysfunction and is more frequent in people who have NAFLD or higher liver fat. That makes it a practical visual clue in the clinic. When we see AN, we think about checking metabolic markers in the liver. If you notice these patches, it's not a cosmetic failure, it's an early warning light. Discuss it with your clinician. They will consider fasting glucose, HbA1c, insulin resistance markers, and an ultrasound or liver screening strategy tailored to your risk. Sign 2. Spider angiomas and itchy soles, pruritus, vascular and itch signals. The second cluster of signs involves blood vessels and itch. Small, star-shaped red marks, called spider angiomas or spider nevi, can appear on the face, chest, or upper arms. These lesions are common in chronic liver disease and are often linked to altered sex hormone metabolism. The liver clears estrogens, and when that function is impaired, higher circulating estrogens can dilate small cutaneous vessels. Separately, unexplained itch, particularly on the palms or soles, can be a signal of impaired bile handling or cholestatic processes. In cholestasis, pruritogenic substances accumulate or activate itch pathways in the skin. The mechanism is complex and not fully resolved. Bile salts, endogenous opioids, lysophosphatidic acid and other mediators have all been implicated. Importantly, severe, persistent itching is a symptom that usually merits prompt medical evaluation because it can indicate cholestasis or other significant hepatic dysfunction. A single spider angioma alone is common and often harmless. Multiple new spider angiomas or new, progressive itching, especially with jaundice, dark urine, or light stools, needs urgent attention. These signs tend to be more common with advanced or cholestatic liver problems, but spotting them early helps a clinician decide the right tests. Sign 3. Referred right shoulder pain, the phrenic connection. The third sign is less obvious, a dull, aching pain that seems to sit under or near the right shoulder blade. The liver itself has a capsule, Glisson's capsule, and when the liver enlarges, becomes inflamed, or presses upward on the diaphragm, it can irritate the diaphragm and the phrenic nerve. The phrenic nerve shares sensory pathways with the shoulder area, so the brain interprets the signal as shoulder pain, a phenomenon we call referred pain. This is not a common cause of every shoulder ache. Most shoulder pain is musculoskeletal, but when a shoulder-type pain is vague, doesn't change with shoulder movement, and especially when it occurs with abdominal fullness, nausea, or visible liver-related signs, a clinician will consider hepatic causes in the differential. So remember, A for the dark velvety patches, Acanthosis nigricans, a marker of insulin resistance. B for vascular marks and itch, spider angiomas and cholestatic pruritus, signals of impaired liver clearance. And C for the quiet, referred ache in the right shoulder. Each sign on its own doesn't prove advanced liver disease, but together, or when present with risk factors like obesity, type 2 diabetes, metabolic syndrome, or high sugar intake, they become important clues that your metabolism and liver deserve a clinical review. If you recognize any of these signs, the next practical steps are straightforward. Book a visit with your primary care clinician or hepatology clinic, bring photos of the skin changes, and ask about baseline blood tests, liver panel, fasting glucose, HbA1c, lipid profile, and a liver ultrasound or non-invasive fibrosis assessment if indicated. Early identification means more options and a much higher likelihood of reducing liver fat with lifestyle and metabolic interventions. This chapter is the practical heart of the video: how to reverse insulin resistance, medically phrased, and thereby reduce liver fat. I'll give you science-grounded, realistic steps you can start using today. These are metabolic strategies, not magic fixes. 1. Cut liquid fructose, first and easiest target. Liquid sources of fructose, soda, sweetened beverages, many fruit juices and some energy drinks, are handled differently by your body than whole fruit. The liver metabolizes fructose directly, and fructose is a potent trigger for de novo lipogenesis, the liver making new fat. Reducing or eliminating sweetened drinks is one of the highest impact single dietary changes for lowering liver fat. Practical tip: swap sodas and juice for water, sparkling water with a squeeze of citrus, or unsweetened teas. If you drink smoothies, be mindful of portions. Whole fruit has fiber which slows absorption, but excess liquid fruit sugar still adds up. 2. Use time-restricted eating, intermittent fasting, as a metabolic lever. Time-restricted eating, for example compressing your daily eating window into approximately 8 to 12 hours instead of grazing all day, gives the liver extended periods without incoming fuel. That metabolic window can promote burning of stored fat and improve insulin sensitivity in many people. The evidence is promising, though still evolving. A number of clinical studies show improvements in liver markers and metabolic health with time-restricted feeding. Start gently. Choose a realistic eating window you can sustain. Even moving from ad-lib grazing to a 12-hour overnight fast is beneficial for many people. If you have diabetes, are on medications that cause low blood sugar, or are pregnant or nursing, discuss any fasting change with your clinician first. 3. Aim for modest, sustainable weight loss when appropriate. Clinical data show that modest weight loss disproportionately reduces liver fat. Even 5 to 10% body weight loss can significantly lower intrahepatic triglyceride. Larger losses produce greater reductions in liver fat and inflammation. Weight loss is often the cornerstone of improving steatosis. 4. Move more, especially resistance training plus aerobic exercise. Exercise reduces liver fat even when weight loss is modest. Both resistance training and aerobic exercise have been shown to reduce hepatic fat and improve insulin sensitivity. Combining them is practical and powerful. If you're new to exercise, start with short, regular sessions and build up gradually. 5. Favor a Mediterranean style, lower refined carb pattern. Prioritize protein and fiber. Compared with very low quality, ultra-processed diets, Mediterranean-style eating, higher in vegetables, monounsaturated fats, whole grains, nuts, fish and olive oil, has been linked to improvements in liver fat and metabolic markers. Also reduce refined carbohydrates and prioritize lean protein and fiber to stabilize blood sugar and insulin. Finally, don't underestimate sleep, stress management, and medication review. Poor sleep and chronic stress worsen insulin resistance. Certain medications and conditions influence weight and liver health. Work with your clinician to align all these pieces, diet, timing, movement, sleep, and medical care, into a sustainable plan. Taken together, these metabolic actions, cutting liquid fructose, creating a regular fasting window, modest weight loss, exercise, and a quality diet, are the most evidence-backed ways to improve insulin sensitivity and reduce liver fat. In the next section I'll explain how targeted micronutrient and botanical support can assist your liver while you make these lifestyle changes. We've covered the metabolic steps you can take to reduce liver fat. Now I'll explain how carefully formulated botanical protocol can support the liver while you address the root metabolic drivers. I want to be clear up front. Supplements are an adjunct, not a substitute, for the diet, timing, movement and sleep strategies we just discussed. They can provide biochemical help while your lifestyle changes take effect. The formula I discuss here is called Reliver Pro. Think of it as a targeted biological support, concentrated, standardized botanical extracts plus micronutrients selected to support antioxidant defenses, healthy bile function, and cellular protection in the liver. Below I'll summarize the key ingredients and the rationale for each, and I'll note what the clinical literature currently shows. Silymarin is the best studied botanical for liver support. Laboratory and clinical studies suggest silymarin acts as an antioxidant, modulates inflammatory signaling, and may support cellular repair pathways. Several randomized trials and a recent systematic review report improvements in liver-related markers and histology in some patients with NAFLD, NASH, although results are mixed and larger trials are still needed. Artichoke extracts have been shown in small randomized trials to improve liver enzyme tests and reduce ultrasound-detected steatosis in short pilot studies. Proposed mechanisms include improved bile flow, antioxidant effects, and favorable effects on lipid metabolism. They can be a practical part of a liver support formula alongside lifestyle work. Dandelion root and leaf extracts have antioxidant and anti-inflammatory activity in preclinical models, and some small animal and early human studies suggest they may help reduce hepatic lipid accumulation and oxidative stress. The clinical evidence in humans is limited, so we include it as a supportive botanical rather than a primary therapy. Reliver Pro also contains targeted micronutrients, for example antioxidants and cofactors that support phase 2 conjugation and mitochondrial function, which help the liver process oxidative stress while mobilizing stored fat. These nutrients are chosen to complement the botanicals and metabolic changes, not to replace them. Multiple herbal compounds, including Silymarin and Artichoke, have shown promise in trials, improvements in liver enzymes, some imaging markers, and in select small histology studies, but trials vary in dose, formulation and quality. That's why a standardized, quality-controlled product matters. Inconsistent herbal preparations are less likely to give predictable results. If you're taking medications, especially blood thinners, statins, or medications metabolized by the liver, check with your clinician or pharmacist before starting any herbal protocol. Also avoid supplements during pregnancy or breastfeeding unless explicitly approved by your clinician. And if you already have advanced liver disease or cirrhosis, do not self-treat, work with a hepatologist. Reliver Pro is designed to be taken alongside the metabolic strategies we discussed: reduced liquid fructose, time-restricted eating, exercise and sleep, to provide biochemical support while your liver mobilizes fat. Many patients report feeling supported during the initial, sometimes uncomfortable phase of metabolic change. But remember, the foundation is metabolic change. The supplement is a biological tool, not a miracle. Here's the final, most important thought. Your liver is quiet, but it is not helpless. Those dark, velvety patches, unexplained fatigue, or a nagging ache near your right shoulder are your body's way of asking for a metabolic reset. And in most cases, when we catch it early at the steatosis stage, we have powerful, evidence-based tools to help. Practical recap. 1. Think of those skin and symptom clues as reasons to check your metabolism and liver. 2. The strongest, proven levers are metabolic. Reduce liquid fructose, adopt a sustainable time-restricted eating pattern, improve diet quality, increase movement, and prioritize sleep and stress management. 3. Botanical, micronutrient-based support like Reliver Pro can be a sensible adjunct while you implement these changes, not a replacement for them. If you suspect you have signs of fatty liver, bring photos and your questions to your primary care clinician or a hepatology specialist. Ask about basic labs, liver panel, glucose, HbA1c, lipids, and, if appropriate, an ultrasound or non-invasive fibrosis assessment. Early detection expands your options and improves outcomes. If you'd like a place to start, check the link in the description for the clinical-grade liver support protocol we discussed in a one-page guide that summarizes the metabolic steps. Use it as a checklist to discuss with your clinician. As a reminder, this video is for educational purposes only and is not a substitute for professional medical advice or therapy. Speak with your healthcare provider before making changes to medication, starting fasting protocols, or beginning any supplement. You don't need to wait until pain or a crisis. Your liver wants to repair. Small, consistent changes and thoughtful clinical support can meaningfully reduce liver fat and improve how you feel. Thank you for trusting this information, and take that first small step today.